Well, Dr. Falk, thank you so much for coming. This is it's an honor to be able to have a doctor in here, something a little different than my normal racing thing that I've been doing.
Absolutely. Thanks for having me.
Yeah, I've been very interested in health, medicine, that sort of thing for, I don't know, probably a lot of my life. And once I saw you, who at the time was a pediatrician for my children, started putting videos out and some information out that you were making a decision to walk away from traditional medicine and started putting out some informational videos, I knew I just had to have you on and talk a little bit more about that, because it's usually something if I see someone talking about, medical things, it's some doctor online that I have zero connection to and, not in my hometown community. So I knew that I wanted to reach out to you, and I'm glad you have the time to make this all work.
Yeah, thanks for having me. There's lots of stuff to talk about in medicine right now.
Yeah, I know there is, and we'll definitely get into that. And but before we get going with that, a little bit of an intro on you. You're a board-certified pediatrician, mom of 3.
Yep.
Attended UW-La Crosse for 4 years for your undergrad. Attended medical school at the Chicago Medical School for 4 years.
Yep.
And then 3 years of residency at UW-Madison. And then after that, worked at a clinic in your hometown the last 8 years.
That is correct, yeah.
Did I miss anything?
Well, in my hometown, I did full scope pediatric care. So the clinic stuff that your kids saw, and then also we covered 24/7 coverage of the hospital, which includes babies when they're born. If they need help, we do that. We're far away from any intensive care units, so much of my time was actually trying to make sure babies were okay until we got them to help. And so, and then pediatric inpatient stuff too. So
gotcha.
Yeah, that was probably my biggest headaches and high heart rate moments as opposed to the clinic.
Yeah, and honestly, until you said that, I didn't even remember this. I remember when our daughter was born. She was a C-section baby, came in the middle of the night, and she had all that anemic fluid built up, and she started choking on it. And I think you had just come into the room and helped clear her up, and that was, as a parent, and as a first-time parent, that was definitely a high heart rate moment for me.
I tell all my medical students, you should be terrified of babies. They are just the scariest, and knowing how to deal with them is kind of an art. So it's one of my favorite things to do.
Gotcha. So like I had mentioned, since you were a pediatrician for my children, I had asked them, do you have any questions you would like to ask Dr. Falk? So we're gonna start off with ones from them. And these kind of really come from both of them, but what's your favorite part of being a doctor?
I love helping kids feel better. That is my absolute favorite thing about the job. And kids are really cool because they get really sick, which is interesting from a doctor perspective, and then they very often can get very better very fast as opposed to grown-ups.
Yeah.
And so I just love that almost instant gratification that they usually give. So
awesome.
Yep.
And then, do you have any cats or dogs?
Ooh, I have 2 dogs.
2 dogs.
They're doodles.
Okay, we have one of those.
Nice. They're Charlie and Jack. So
okay, perfect. I'm glad you gave me the names because I knew I'd get asked if you didn't tell me.
Charlie and Jack.
Oh, wonderful. So now I know you were in the Wisconsin Rapids area at your clinic prior. Were you born and raised in Wisconsin Rapids?
I was born in La Crosse, but then my family quickly moved to Wisconsin Rapids for my dad's job, and so that's where I did all of my schooling. I graduated from Lincoln High School. I was the valedictorian of my class, and and I always knew I wanted to be a physician. My mom worked in healthcare. She was a respiratory therapist, and so I just thought she'd come home from shifts when I was Maya's age, and I was just so interested in what she did, and just wanted to hear all about that. And so I think as school went on and it became clear I had the academic prowess to be able to do that, it was just sort of a one-lane street for me. I just kind of kept going. So.
Okay. So right from childhood, kind of just always had that feeling, I'm going to be a doctor or something in the medical field one day?
Always be a doctor.
Always be a doctor?
Yeah, I don't know why. It just really seemed like something that was just a part of me, and especially as I got older and learned, in high school when you can take more specialized classes, I took human anatomy, and it was the hardest thing I had done at that point, and I was like, I love this, give me more hard things, and so just kept doing it. Yeah.
Gotcha.
Yeah.
Now, just your childhood in general, besides being interested in what your mom was doing as a respiratory therapist, what was childhood like for you, and what did you kind of grow up doing, and did you do any sports through school, or what were you interested in?
Yeah, I was in dance. So there was a dance school. It's not there anymore, but that was very serious into like Russian ballet. And once you kind of got in, you never got out. You just kind of kept going. And so I did that through my entire childhood, through high school. My brother was really involved in sports, so I was kind of peripherally involved that way. But like 4 days a week, on top of like homework and stuff. So it really taught me a lot about discipline. I actually credit a lot to that school. There's actually several physicians from my hometown that came out of that dance program.
Interesting.
And I think a lot of it has to do, obviously, with just who we are, but then the amount of like discipline and just things that dance or other sports too, but specifically our teacher was able to kind of like drill into us. It just translated really well into the medical field.
That's cool. Yeah, that's always cool when I think it's great when someone can be involved in something, whether it's a sport or any sort of, if it's martial arts or some sort of hobby that can kind of instill those, good values in you. That's, I think as a parent, you can only do so much to instill values in your children, and what your surroundings, have a large impact on a kid. And I think that's pretty cool. So kind of going through there and kind of always knowing that you wanted to be a doctor, did you know right from the get-go, I want to go into pediatrics, or did you kind of weigh other options too?
That's a good question. In medical school, so I did college, and you have to take some big tests to be able to apply to get into medical school. And you do a bunch of interviews, and less than 10% of applicants get into U.S. medical schools. So it's a big pool, small amount of spots, and just because it's very expensive to educate medical professionals.
Right.
But all that to say, I really liked kids. I actually job shadowed with a pediatrician in our area who I ended up working with for a long time. And he just kind of made me fall in love with peds. But in medical school, doing different rotations, and 2 years of medical school is mainly just books and like cadavers and just like really, you're not really in the clinical world, maybe a little bit here and there. But the last 2 years, you're really like thrown into every specialty, and you got to kind of try them all out. So I loved the ER. I just absolutely loved it. I did my ER rotations in inner city Chicago. And so
that had to have been busy.
Gunshot wounds. It was crazy, like gang stuff. And I mean, as a medical student, it was amazing. And I saw how burnt out all the docs were. And I'm like, that's clearly not sustainable for a whole career, especially in a small, we knew we wanted to come back to a small community. And obviously ERs here can be very busy, but some less acuity. And I just wondered if that would be kind of enough. So I liked anesthesia a lot. And then I realized I just liked kind of the mechanism of anesthesia and all the science behind it and all the meds. I thought that was super interesting. You're in charge of keeping a human alive while someone rearranges stuff. And then I realized how much I hate the OR. There's just, it's just a whole different vibe clinically. So, but kids, I kept coming back to that because they just, as I said, they're just really interesting. The pathology is really interesting. I think it's taboo for medical professionals when we say, like, it's really cool when people get sick, and it's not good for the patient, but you want to have people who like thinking about that and can think about it. And a lot of people, get really triggered when kids are sick. And I found that didn't really happen to me. And I just was like more pushed to figure out what was going on. So, I just kind of settled into pediatrics. So.
Okay. Gotcha. Going back to the ER in Chicago, I mean, I imagine you probably learn a ton really, really fast being in that sort of setting.
Yeah, it was wild. So I did a 4-week clinical rotation, as we all had to. We would do like 8 weeks in internal medicine, 6 weeks in peds, 8 weeks in surgery, and then ER and neuro and some other stuff. But that was all in the third year. And that was the year you had to figure out what you were going to do with yourself. Because then you would apply to residency. So that's a whole nother kind of phase. But in the ER, I mean, they really would just like drop you in the middle of a shift, and everything's kind of happening around you. And so the best students, and I teach medical students, and so I always tell them, just like drop in, roll up your sleeves, and just find a way to be useful and find a way to learn something.
Right.
And I would kind of glue on to certain nurses that would be willing to teach and to talk, and learned a lot of really cool procedural stuff. And doctors want to teach. Many of us really like to teach, but when things are just chaotic, it's easier to figure out a way to be useful. And so I think that's kind of, it was a place where there was so much going on that there was a lot I could do. Like, I was suturing stuff that I'd never done before. It's like, well, we'll figure it out as we go here, and there was just such a need that,
Sure.
there was a long leash for that. So
Yeah. Throughout your, the going to school to be a doctor, what do you say was the difficult part? You talked about having to apply and be able to get in, and then having to make the decision on, hey, this is what I want to do. Go down that pediatrics line. What was the most difficult part of all of that?
the hardest part is getting into medical school. And
Okay.
then once you're on that train, there's almost no way to get off.
Okay.
They invest so much into you. And so I've seen a lot of I've seen some medical students where they're struggling academically. They'll do anything to keep them on the train to graduation.
Sure.
And so whether that be extra time, extra tutoring, extending the time, which I didn't do. But so the hardest part is just getting into the cohort and just being able to be a part of that. And then after that, it's all very difficult, whether it be studying for 12 hours at a time, 7 days a week for 2 years. If it's in the clinical, you're standing in surgery for 8 hours at a time. You've never done that. You're helping in an ICU type setting. All that's hard in a different way, but it's
Right.
not the almost insurmountable thing of getting in.
Okay. Gotcha.
Yeah.
And then while you were doing your residency in Madison, UW-Madison, I think you kind of made a mention of that already, but you knew that, hey, I want to try and get back to my hometown community.
Yeah, that was our goal. My husband is a private practice optometrist now, and
Okay.
So he went to optometry school in Chicago when I was there, and then that's kind of the end for them. They can do a residency, but it's not needed, and he didn't need to do that. And so he worked at a kind of a corporate clinic in Madison while I did my 3 years as an optometrist. But his sights were set on joining and then eventually kind of taking over a practice for an older optometrist in Wisconsin Rapids. And so, and we have family around, like we have family in the area,
Sure.
specifically in Wisconsin Rapids, Wausau. So that was a huge piece of it too. And when you're in residency, when you graduate, you can become a board-certified general pediatrician, but then you can also do extra training to be a peds ER doc, an ICU doc, a heart doc, so there was some, I've always said in a different life, I'd be an intensive care unit doctor, and my
Okay.
husband's like, go for it, but then we're stuck here, like now we're stuck in big cities where they need
Sure.
that type of care. And so we collectively decided in a small town, I can do enough of that acuity to keep me happy. So,
Okay.
Yeah.
Gotcha. Now, I mean, I know, nowadays people talk about a shortage, whether it's nurses or, any just physicians in general. How was it difficult to be able to hey, I know I want to work in my hometown, but to actually be able to get a job in your hometown, was that, and, was there just, what does it look like for availability to make that happen?
yeah. Once you're a healthcare provider of any kind, nurse practitioner, doctor, I don't want to say the sky's the limit, but you can pretty much say, this is where I want to be, and most places will take you. Even
Okay.
now, since the COVID pandemic, and it wasn't the virus COVID, it was everything that it exposed about the healthcare system that was
Sure.
falling apart. I always make that distinction because it's obviously
Yeah, probably a
thing.
good distinction to make, right?
So it was just everything that exposed, and I was an attending physician at that time, and I watched, just lots of stuff lay bare that I think would have been exposed in time, but I think was just accelerated. And so as a result, as you know, many healthcare providers have left the field completely. They're just like, I want to work at Starbucks. Like, I'm not doing it like this anymore. And it's only gotten worse as time has gone on as far as shortages, especially in rural areas. So you can go.
Have you actually seen that recently where physicians are leaving and doing some completely other different career path? Okay, really?
Yeah, I get news articles all the time, like from the doctor space, about just physician burnout in general is causing people to just abandon and leave the post altogether, like just do something completely else, and then also the rate of physician suicide every year, over 100 docs in the U.S. end up committing suicide. And so between the two of those, I think it just says something about our healthcare system.
Right.
And, we talk about, the shortage of, we just need anybody with a pulse now. And that's not always the best for patient care. So, yeah, it's a double-edged sword for sure.
Yeah. You had mentioned that your husband's a doctor too. So then, is that where you guys met? Was down in Chicago?
No, we were high school sweethearts.
Okay, so he was from the same town too.
We
Cool.
went to the same middle school, and then high school. We started dating in high school, and then it just kind of, I always say, it just kept happening, which is not a romantic way to say it, but we did. We went to college together. He was going to be an athletic trainer, and then he's like, "That's kind of boring. Maybe I'll be a doctor." And I was like, "What do you mean? I've been planning my whole life to be a physician, and now you're just gonna pull it out of thin air," and he did. So, but it's actually been great. He is a doctor, but completely different type than mine. He doesn't have the acuity that I do, especially as I was working with my previous employer. You know, there'd be times where I would just be called and then I have to go, and I'm just gone for hours. And he just never had that type of acuity, which worked really well that in our family system.
Yeah, that'd be pretty difficult if that was the life that both of you had to live.
Yeah, we had our first kid when I was in residency, which is not a no-no, but it's definitely really hard. Like, you're working upwards of 80 hours a week.
No kidding.
Every week, and that's the cap. And, you know, many of us go over for, you know, how are you going to leave a shift when everything's on fire? You're just not going to go. So, you know, I called myself the milk truck. Like, I just kind of would appear at night after bedtime with, you know, a whole bunch of milk for the next day, cry, go to bed, and, you know, not see my kid for a while. And not every rotation was like that, but many were. And so, we have 3 total, and the rest he's like, only 1 in residency. This is plenty
right
to have to deal with. But he's mostly okay. That kid, he's mostly fine. So
good. So then coming back, once you were able to, you know, come back to your hometown, you know, how much did you love, you know, starting out being a pediatrics physician? I mean, how much did you know, like, hey, I made the right choice in doing all this?
Yeah, it was pretty clear right away. Like, I kind of set myself up in my residency. I knew I'd be doing a lot of, like, intensive newborn stuff. Like, you know, your story of your kid kind of choking on amniotic fluid. That's like the least of the things that we have to deal with. And so which is great. But I did a lot of really hard rotations and kind of really pushed my superiors to, like, let me do more, because I knew I would be on my own in a place 2 hours from a NICU. And so, so I think, you know, just coming out, it's terrifying to just all of a sudden you're in charge, you know, when previously you had like 3 levels of people ahead of you, making sure you didn't make a decision that was not the right one. But now all of a sudden you're on your own. And so that's a huge mental leap. But as I said, I had really great partners that had been in the game for a very long time, and I could just hop in their office and be like, let me tell you about this kid, and we would talk about it. And most of the time it was just reassurance that I was on the right track, or they were on the right track. But I think that's a huge piece, is making sure there's really great camaraderie between the different departments, and then, you know, making sure you have people that you can run things by, because it's a really lonely thing. And, you know, when a kid's health stops with you and the decisions you're making, that can be a huge mental toll. So,
yeah, I mean, obviously, you know, as a parent, you know, if you're having a medical issue, you know, if it's your own issue, you want answers and be able to trust somebody. But when it's your kid, it's, you know, it's a whole different thing. It's like, I want answers. I want to know that they're right and that he or she's going to get better and everything's going to be A-okay very quickly.
Right. And I think, you know, in the course of my career, just, you know, statistically, you're going to catch, like, I've caught cancer, I've caught, you know, just things that you just pick up. And that's why a really good, solid pediatrician, or, you know, a medical home is so important, because sure, it's a lot of fun. It's a lot of, you know, healthy babies and sports physicals and stuff. But I don't know, several times a year I would catch something wild. And then, you know, having to look the parents in the face like, listen, I don't know what this is right now, but here's how we're going to get there and figure this out together. And I think that is one thing I did really well. And walking parents through those really dark times.
Sure.
And when we're all terrified, like, you know, when I'm not even sure what's going on, that's not a great.
Would you say, you know, when you stumble upon something like that, like a sign of cancer or something like that, or something that's unknown, are those, you know, as a pediatrics doctor, the toughest moments for you personally?
Yeah, I think the hardest moments are when we don't know what's going on. Like, you know, I've caught diagnoses where things look completely bad, and I know that, and we know where to go for the next steps. I think it gets better for all of us once we know what it is. So when you have some scary name for it, it's bad and scary, but now we have a roadmap. Like now
Right.
we know what we're doing and where we can go. So I think, finding somebody that can, number one, identify stuff and like know what's okay and what's not okay. And there's, that's just such an important piece of healthcare. And a lot of it's super fun. I don't know, pediatrics, in my world with reels and stuff, peds is always made fun of. Like we're always wearing like unicorn hats and we're always handing out stickers, which is super true. And
you got to be welcoming to the kids.
Absolutely. But we all, it takes some prowess, I think, to be able to get what you need from the kid and then also walk them through that if that comes up too.
Right.
Yeah.
Yeah. So I think that kind of, really leads us to, kind of where I had the thought of reaching out to you and wanting to talk to you. I have listened to podcasts or news things, and people kind of throw out the words, big pharma, talk about problems in the medical industry. And, it's usually, it's some sort of doctor that, I have no connection to, and you hear a little bit about it. It almost seems a little bit taboo to kind of talk about. And, the general population doesn't really, that's outside that industry, doesn't really know a lot about it. I saw that, you were going to be leaving traditional medicine, looking at doing your own thing, and started, putting out some content on Facebook and on your page. And we'll talk a little bit more about that as we go on. But when did it start setting into your mind, I think I might need to look at doing something a little different, and I'm not sure quite what it might be, or maybe you did know what it was going to be. When did that start coming to mind?
So for the past several years, I think, where I was at, there was myself and there was like an aging group of a couple other docs, and there was just really no urgency from the institution I was working at and like trying to figure out how we were going to continue to do the job we were doing, which a lot of people didn't see when they saw me, but I would see 25, 30 patients a day in the clinic. And then I would be pulled out to some emergency, C-section or whatever, be there for hours. Parents are unhappy because we had to cancel their appointments. Then I'd have to be there through dinner time, through bedtime. We delivered many people, and that population was getting sicker and needing more help. And so, the question I was asking was, how can we build something that can be sustainable? Like build it around me. I'm a young physician who's from here. Let's figure out a different model, because a model that's worked for 30 years doesn't seem like it's going to be sustainable. So
and
what
I
are we
think
gonna do?
kind of interject in it. I think, whether it's any business or just kind of anything in general, if you're doing the same thing now as you did 30 years ago and doing it the same way, it's
Right.
you're not going to be around in another 30. So
Right. And
you got to adapt.
And that's happening all over the healthcare industry. A lot of people are, they're owned by these massive organizations that are mainly driven by the bottom line, and as most businesses are, obviously. But then those of us carrying out the work are like, this isn't working. This is burning me out. This is burning my family out. This is burning out all these nurses. So let's create something a little different, maybe a different model, whether that's a hospitalist system or some other way to do this. And when it's met with, we'll just keep looking for replacements, and those aren't coming for years. We're not having any applicants. It's very hard to recruit physicians right now, especially to a rural area. And and so, especially in the model that we're doing, many grads don't want to do what I described, where you're hopping all over the place. You're kind of pulled out of clinic, you're pulled out of your house, you're pulled out of bed. Many don't want to do that, or at least in the way that was presented where I was. And so I did, and I made many attempts to kind of work with them, work with my partners, like help me build something cooler and different that we can all kind of do for as long as you want and as long as I want. And I just realized nobody was going to be coming to my rescue, so I'll just have to come to my own rescue, and jumped off the ship.
Sure. Now, what do you, I think nowadays, all sorts of industries, are having difficulties and coming up with many different unique ways. Hey, how can we get more welders? How can we get more, people in this trade or that trade? Just in the medical industry in general, what do you have any thoughts on what attributes to just the difficulty? Is it, specifically the area, or is it just, doctors, nurses in general sort of a thing?
Number one, the U.S. is not putting out enough physicians every year, and that's because of what I described to you, how long it takes to become a physician, and the amount of clinical hours it takes to do that. The training programs are expensive, but also when you're a resident, you're making a fraction of what you make when you're a real doctor, and so you're kind of doing not free labor, but very cheap labor, and so it can be very hard to add in physician spots every year. There's just less and less desire. When I was growing up and wanting to do this, it was like a really noble profession and a really not high stature profession, but like when you were a doctor, like that really meant something. And now it's becoming, as I said, since the pandemic, not the virus, the thing that happened to the system, it's harder and harder to do that. So physicians right now are met with the administration side that's telling them, do more with less, do more. We're not going to fix it for you. You're just going to keep taking care of patients. And you do because what else is there? Who else is going to do it? Me. And then you have a public that's rightfully becoming more and more skeptical of the healthcare system, but they're aiming it at physicians. And that's exhausting, when you have, and I love explaining to parents what we're doing, hey, let's talk about what I'm recommending. Let's all get on the same page. Absolutely. But when it's met with such animosity that has been presented for the past 5 years, it just wears people out. And so I think now people are I'm not doing that. I wouldn't encourage my children to do this profession. And so, which is a huge shift from previous generations.
Sure. And were you, having a mother that was, in the medical field, you probably certainly encouraged, hey, yes, you should, go ahead and do that. Yeah,
it was just a totally different time. And I think the past 5 years for sure has really changed that. And there's got to be a change. We got to not burn our physicians out. We need to make more of them. We need to train other ancillary staff better to be able to support a population that's getting sicker and also more skeptical and kind of hostile to the healthcare profession. And again, there's a lot of concerns that the public has that's super well founded.
Right.
But also docs, nurses, all of us are in the same cruddy system that I think needs to just be rebuilt for patients, for the little people I take care of, because it's not doing a great job for them.
Yeah. Well, I know the one thing I will comment on, you said that people always have looked at doctors as being a noble profession. I think for those of us that aren't doctors and don't know how to figure everything else that's going wrong with our kids and us, we certainly look at it as a very noble profession. Well, but I whether you're a person's an engineer or whatever you're doing, if there's something going on in that profession that you're not pleased with, I'm sure it diminishes the way you feel about yourself and what you're doing. So I'm sure that kind of attributes a little bit to that feeling.
Yeah, it's so interesting. And now in the age of the internet, this is well documented. People are talking about do your own research, which is amazing. And I love when people are empowering themselves like that. Also, to your point of this is a kind of a racing show. I know zero about cars, and so my example I give when I feel like I'm trying to be micromanaged by a family or whatever is, listen, I can't go to the mechanic and say, I watched a podcast. This is what we're going to do. I don't trust them, but, explain it to me, let's learn together, because I will describe that my car is coughing, and that is, all I'll give you, because that's all I know. And
right.
So I think, anyway, that's just an interesting time and a distinction right now. But, yeah.
So decided to make the decision to jump off the train of traditional medicine. When thinking about having your own practice, I imagine that's probably I imagine with your husband having a practice, there's probably a phenomenal resource as to where do I need to start looking at things? I mean, being that it's obviously very different than pediatrics, is there still things that are relatable and trying to do that?
Yeah. So just a clarification, I'll still do traditional medicine. I'm still a medical doctor.
Yep.
I'm not doing some, alternative stuff, at least not
Traditional healthcare system.
Yeah, like corporate medicine. Yeah. So there's got to be a better way to do it. And it's funny because, 50 years ago, many doctors were private practices. You would go to the doc down the street and he had his practice and he'd see the whole family, and that was just how it was. And what happened was, in the 80s, 90s, big pharma, big medical industries came in and gobbled them up because it was too hard for them to function on their own. And so with the rise of the medical record systems, like electronic, it was too expensive for them to do it on their own. They just couldn't afford a lot of these pieces or didn't want to look at the logistics of it. So they kind of sold into these big systems.
Hey, I can have someone else take care of this end of it for me. Why wouldn't I?
Why wouldn't I? And why wouldn't you? Like, that's great. And, let me just do the doctoring piece. And then something happened in the early 2000s, 2010s, where we physicians and practitioners just lost all control, even when we come to say, this is not working for the patients, this isn't working for me. It just really is met with, well, we're a business and we're completely in charge. And that just feels really yucky when you're trying to, make little changes. And now you're part of this huge system. It's like, well, no, that's not going to work up in Anago. So no, there's just no kind of, not autonomy, but there's no individuality of how you can practice. And that just feels really frustrating. And this is happening all over the country as health systems get bigger and bigger. Like now health systems are encroaching on many states and they want you to practice in one way. And that's just not feasible because we're very different than whatever's happening in South Dakota,
Right.
This community. And especially someone like me where I grew up here, these are my people. I take care of my friends' kids. I take care, it's really, it's an interesting time. And so it became very easy for physicians just to latch onto these businesses and let the business thing do its thing. But somehow business has ranked back and now controls how we do medicine. And I think a lot of us are wait a minute, it's not what I signed up for and it's not good for my patients. So,
yeah, I think like anything, once again, just relating it to anything, even outside the medical field, it's, when business becomes business and things are driven by, the dollars and cents of everything, and things get bigger and bigger and bigger, it's very easy for people that are completely disassociated, that don't really understand everything that's happening on the front lines of, patient care, things like that, and it gets very, very distorted very, very quickly, I'd imagine. And actually in one of your videos, one of the statistics that I thought was really interesting was for every one physician, there's 10 healthcare administrators.
Yeah, that's correct. It's funny, there's a graph, I think I have it in that post, but the number of physicians, and even if you add in providers, so that's including physician assistants and nurse practitioners, this graph doesn't, but even if you were to include them in that, the incline year to year of those stocks is minuscule, and healthcare administrators did an absolute exponential increase, and they continue to do so. And they'll say the business of medicine needs that, they need that many people to do that. But to me, it just really takes away from what we're all there to do, and they're not there to do what I'm there to do. And I think in the middle of that, my little 7-year-old patient gets totally lost, and their family feels totally lost in the system. And they sometimes, and many times what I hated most about being in that system was I felt like a Walmart checkout many times. And I would get reviews oh, she was really rushed. Well, she was rushed because she came from an emergency C-section. That kid is still there. She's trying to do 2 things at one time.
Sure.
And obviously the day-to-day doesn't matter to the patient. The patient in front of me needs the good care, and that's all that matters. Mm-hmm. But you can see how day after day, the moral injury of that can really add up, and patients feel that.
Oh, sure. I really, I think about that, probably something that's maybe a little bit more understandable for some people is I think about a police officer. Mm-hmm. Hey, I had this interaction and he wasn't the nicest guy. Well, he probably had to just deal with some domestic thing that was either just horrific, who knows what that police officer had to be involved in. And now, they're dealing with your parking ticket. It's total different contrast of issues to have to deal with, and you're trying to do it all well.
Yeah, it's wild. I have a clear recollection of like I was slammed all morning at the hospital doing some really high level stuff that, the NICU had to come and take over. And then I'm dropped into like a sore throat visit and, which it was like in my mind, I'm like, my God, this is like whiplash, and obviously you can do it, but it's just the toll of that over time, I think is similar to your, with law enforcement, the same. And a lot of times we work side by side in the ERs. There's almost always a police presence. And many times I would call them to like help keep me safe during certain patient interactions. And so, no, I totally have huge respect for them and kind of that same kind of moral injury vibe. Yeah.
So one of the things that, you had talked about was that losing that interaction with and maybe being able to make the choices, maybe not, you're able to make the choices you wanted to make, or I guess I'll let you elaborate on that, but kind of losing that feel of that, there are being things in the way between you and your patient. Speak on some of those things that I guess that some of those things that you felt were in the way that, affected, the way that you had done your job that led you to the path that you're on now.
I think there's a lot of different buckets. One would be insurance in general. So like every patient has a very different type of insurance. There's obviously state-run insurance that can be very restrictive. And even, employer-based insurance, the big ones that are supposed to have the best coverage, many times have crazy high deductibles where families are, they think they're well covered, but then 3 months down the line, we chose collectively to do some labs, an expensive workup to make sure kids safe with whatever's going on. And we all agreed to that. And people ask me like, oh, how much is this going to cost? And I have no idea. And I have no idea for many reasons. One, there's no like transparent pricing. Like you can't just call and get a list and like, this is what it is. But two, there's so many different negotiations and different like levels of different plans. It's just so opaque that families really have no idea until the bill comes 2 months later. My middle kid, Eli, has kidney disease. And so he had like a whole lot of stuff when he was a baby. And now he's like fine. Now every 6 months we just do imaging and labs. And those labs are the same ones every time, the same ones you get on any kidney kid. And we got a bill for $1,600 for this because we hadn't met our deductible. And that happens to us every 6 months. And if you look, there's ways to do wholesale labs where those same labs would be like $80. And it's like, where's all that going? And why is it so different patient to patient? So a lot of times, families would be like, we can't afford a workup. And so I'm like, well, I can't reassure us, with what's going on. And so that really is hard. Or maybe they say, let's do it. And I know that's going to be a huge financial hardship potentially for the family. And that's hard. Another thing is when I know we need to go see a specialist and off we go, there's not a lot of kids specialists. You're going to be driving. That can be a big hardship for families. But then you have insurance that says they're not covered. They got to drive, 2 states farther to get the same care. And it's, so that can be very hard. And then the family's like, well, we're just not going to go. Can't you deal with it? It's like, well, I'm at the point where I need help, and now we're stuck in this, like, now we're just doing like, we call them curbside consults. You're just hoping someone can like give you the next steps. And so that can be hard. And then finally, as you mentioned, big pharma, with, pharmacy benefit managers and those sorts of things. I have no idea when I type in a medicine in the medical record system what it's going to cost to you because it's going to be different for you than me. And like, why is that? The med from the manufacturer costs $4 and it's going to cost you $80. Like, and then pharmacists take the brunt of that. And many local pharmacies are struggling. Many small pharmacies where they really know you and people like that. Yeah. They're closing. They can't stay afloat in this current climate of how drugs are handled in the U.S. And then you obviously have a population, both kids, but for sure the elderly and, middle grown-ups are getting sicker and sicker with many things, diabetes, whatever. And so now they're on more meds. And so you can see it just like builds this whole system of kind of distrust and a total circus for families and for physicians. Like if I say your kid needs this med and your pharmacy says, or your benefits say, nope, now I have to find an alternative that might not be as good. And that sucks for me to have to say, like, this is like my second choice, but it's best we can do unless you want to pay $500. Like, not a lot of it makes, it's just too big, I think. So.
Yeah. I've heard of, people being recommended, hey, I think you should have this prescription, and then, maybe they're on it for a while, it doesn't work, and then they figure out that there's another option, and the one that they have been on, is only such a percentage effective, and there's this other one that isn't, or is more effective, but, it may be harder to get, or it's maybe not encouraged, or we'll just keep trying this one. And I always find a scenario like that really interesting, and then you start wondering, and then the term big pharma comes up, and it's like, well, I wonder why I'm not being encouraged to take this over that. And I guess one other question I'd have is, have you, probably over the last couple of years, have you seen it with, maybe, the popularity and, like dyes in foods, and, whether it be, different oil, like seed oils, things like that in foods, and people kind of starting to grab on to maybe learning a little bit more about that sort of health and things like that. Mm-hmm. Have you seen, maybe like patients or like their parents, like maybe question things you're doing or saying more? Has that become, more frequent?
Yeah. Yes, it has. And once again, I love these conversations. Like, I encourage families, like, bring dad in who has all these questions, and let's have a talk about it. And also keeping in mind, I love doing that. And when I'm seeing 25 to 30 people a day, and you want to have a big, now I have to describe like how the body works, kind of, for certain things, it becomes almost untenable if a lot of people are doing it, which they are. And I would never say no to those conversations.
Right.
So that's super hard. I think, people, those are all really great hot topics for sure. Food dyes, I've seen many families dump them, and their kids with behavioral issues, like, almost overnight go away. And I think they're hard to study, like, and there's not stellar big studies. And obviously some people have issues with how science is done, and that's a whole nother conversation. But how we understand it, we need like big numbers of people having the same types of outcomes for us to say it's going to work. Because if like one thing works for my kid Eli, and I say, oh, you have to try this for your kid Maya, there's no saying if that's going to work or not, or be healthy for her body. And so I think, I try my best to keep science at the center of it, because I think despite all the gobbledygook of what's happening, that's really how we know what's safe, and I think, for foods and some medicines, it's easy to have these conversations, but, I definitely, if I'm going to go in for surgery, I want it to be one that has been very well studied, buttoned up. There's one way to do it, as opposed to someone who's like, I got a new way, you don't want to be the first of that. So, but no, I think people are onto something there, but also I think we live in such a complex world that there is not one fix. Like, food dyes is not it. And it can be a part of it for sure, but it's like, why are our foods so nutritionally kind of depleted? Yeah. Like, why, my husband always says, so he's an eye doctor, and he says that in the 50s, you could eat one salad a day and get enough vitamin A that you needed to keep your eyes healthy. And now you need to eat like 500 salads or something. It's like on the order of hundreds more. And who's going to eat that many salads? And so my point being, something is happening to our world in general that I think it's, when people on TikTok or wherever are saying, oh, do this one thing and everything's going to be better. Like, it's just, we don't see that.
Yeah, it's not a one-size-fits-all.
My God, if there was, like, let's do that and fix everybody. But, I think the physician job in this moment is to try to keep science in the center, but also keep challenging and asking when there's holes in stuff, that we see from reading this. We need to be cognizant of that too. But
yeah, so kind of going back to those things that you felt were in between you and your patient. With, let's talk about kind of what are you looking to do now? Maybe how far out does that look? Mm-hmm. And then kind of get into some of how do we solve that, and hey, how might this be better for your patients and their families? Yeah.
So the model I'm currently sort of working on figuring out, and it's a new challenge every day. I feel like I pull on one string of like figuring out how to do this, and then there's a whole nother rat's nest of strings.
Yeah, I can imagine.
I think there's a growing model in the country of direct patient care where, we have no insurance in between. And so it's just you having a physician take care of you, for some reasonable cost. And there's no submitting it to insurance and seeing what kind of happens. And so it's a lot more transparency. You can do a lot of really cool things like wholesale labs. Like, as I said, those labs for my kid would be thousands less, which for all families would be very important.
Right.
You can do wholesale drugs where you don't have any of those kind of big pharma things in the middle. Like when, we decide, hey, we're going to treat this infection with this antibiotic. I have it back here. You can just go home with it. A lot of it makes a lot of sense. And I think the most important piece for me in that is that there'd be more time for patients. So patients would have more direct access to me, which I think would be really great, instead of you calling and being on hold for 2 hours and hoping to talk to somebody, and now this person doesn't know that. Sure, I would sneak in anybody, to my 3 p.m. slot, and
Sure.
Now you're being gate-kept and sent to walk in, and you don't know those people. And so anyway, a lot more direct interaction, and this is happening in bigger cities. It's also happening in smaller communities too, all around the country. And I think it's a really important movement, because I think it's a motion of physicians and providers moving back to direct care, where it's just like me doing my thing, and kind of taking out as many of the middlemen people as you can.
Yeah, I think, to relate it to just other things, again, I think with anything you see, this is where something started, there's some sort of evolution and it grows to here. Well, okay, now we end up with a recognizable to some problem, and then now we're going back to, the way things, a new way of doing something that was a little closer to the way it used to be, sort of a thing, or kind of looking at it differently like that.
It is, and there's, some critics of the model where, like, you can't take care of as many. Like, I had a panel of several thousand children who were my patients, and you can't do that in this model, because you have to be, with guardrails in place, but almost always, or many times within many, hours of the day, available to families. Like, hey, they've got a pink eye now. Can you help us out? Like, what does this mean for daycare tomorrow? Like, you want those answers kind of in the moment, and and to not have $1,000 copay with the ER, because that's the only place left for you to go. There's so much of this that we can really kind of take off of our ER colleagues' plates with this. And so it works really well for the elderly, where there's just, kind of that direct kind of care model. They can get their meds more cheaply. They have, more support from their physician that would hopefully keep them out of like acute care, keep them out of the surgery room, those sorts of things too. So I just think it's a really important thing, and obviously as everything evolves over time, but yeah, that's kind of my initial thoughts on how to do it. And I have some really smart business people helping me think about it, and it's funny, the ones I've selected, I've said they're the only business people that don't make me want to throat punch them, because like coming from the business of medicine, it's just so ugly, and I want to build something different, but you also have to know about all these pieces. I've joked with my husband, much to his dismay, that if a parent brought me like a loaf of sourdough bread, like, of course I'll take care of their kid. He's like, we got to have like some sort of model that'll be sustainable. So
can only eat so much sourdough.
Exactly. And so, but on that, I think so many of us have, like, that's where our heads and our hearts are at. We just want to help people. And somehow that got completely distorted and made a lot of us hate how we do our job, or even our job in general, which is a huge shame, because people don't get into medicine to, I don't know, maybe for the fame and accolades sometimes, but most of us don't and never see that. And it's just, I think it's a way to take care of doctors, but then also to better take care of patients.
Yeah. And, obviously with anything in medical expenses in general, insurance is huge. We were talking a little bit about that before we kind of got started, how, the model you're looking at for how that would work for, paying for things, talk a little bit about how that would work and the benefits to that.
Yeah, I've talked to many pediatricians who are doing this model around the country. It's a small but growing group, and they're all super willing to kind of chat. And so, it's a hard pill to swallow for a lot of people. And when I first heard about this, I was like, what? No insurance? Like, you can't, but you totally can. So like, many have a membership model, and I think essentially in the future, that's what I would kind of go to. But you can also do a la carte stuff. Like if your kid has a sore throat, for $50 you can, or whatever the price, but something way lower than whatever your deductible is. You can come in, get the testing you need that won't cost hundreds of dollars, but might cost the cost of your coffee. I was looking at prices for rapid strep testing, and that's literally what they would cost, $4 a test, as opposed to the $125 that you get charged at a big clinic around here, which is wild.
Wow.
But that's one small example, and then you can walk out with the med you need. You're done. You don't have to wait in some crazy line. It can make a lot of sense. A membership model also makes sense for many families. You pay some small fee monthly to have this direct access. You get all the well care you need. I hope to do in-home visits, when it makes sense. I think that'd be amazing, especially for newborns. Like, I think up to 2 months is really something I feel strongly about.
Okay.
And you just get the care you need. When your kid has pink eye, you don't have to go to walk in. You just let me know and we talk about it. Maybe we hop on a, electronic medical record safe call, and we just document it and take care of it. And it sounds so easy. Like, to me, it just sounds like of course that's how medicine should be done. And if a parent thinks about how they currently have to get care, especially if they don't know me and don't have my number in their phone,
right.
But to make that more accessible to more of my patients, I think it just makes a lot of sense. And for many people, now deductibles are so high for many families.
Mm-hmm.
Like, many are on a very high deductible plan. And so that means unless you have a catastrophic event, and insurance is still important, everyone still needs that, because if you do have some massive injury or, illness or something,
car accident,
you need that, because very quickly, and that's a part of medicine I can't fix. But for those catastrophic things, but for the vast majority, 85-90% of well-child care, it doesn't need to hit a $10,000 deductible. You can do it way under that and still have it make sense. So,
yeah, I think that would, to me it makes a lot of sense, and I would think to anyone listening to that, and it would make a lot of sense. And I think I look at again to compare it to something I had looked at. Why is all these foods so much cheaper than some other grocery stores? And it's like, well, they don't, not to just bring up pharmacies, but they don't have a pharmacy, and they don't have all these other things in there. You bag your own stuff, and it's like, well, they don't have all this other fluff associated with selling groceries, so therefore it can cost less. And I imagine it's very in a sense a very very similar way that there's just a lot less overhead and administration costs and things like that when working direct to patient care. Yeah,
and I think it's changed a lot too in the recent decade, maybe less, where before, when electronic medical records became the standard, they were inaccessible to small practices because they were so expensive. Now I could go online for $90 a month and get a pretty good medical record system that would do everything we needed. Parents could have an app, like all the things everybody expects. It's just much more tendable now. And all that to say, the more I've dug into it, it's good. I'm very stubborn, and I just really want to take care of people in my community, that I will figure this out. But it is, there are still so many roadblocks. It's very hard to access certain things still. It can be very hard to know pricing or how do you do that piece. And so there's still, I think a lot will kind of hopefully come in the coming years to make this more of a model that other docs choose to do too. But there's no great guidebook of how to just appear as a practice.
Yeah. And, and we're in the age of technology, and I imagine, as, there was less direct to care, doctors, and, as, larger healthcare systems built up, I suppose, even though now we're probably just getting into a spot where there's the right resources and easy, for being able to set up something electronically so that, just a single practice physician can, set up and do on their own. It's probably a lot more accessible and feasible, whether it's cost or just, the ease of the system itself. It's probably, we're probably just evolving to that.
Yeah. Every several months, there's more and more medical record systems that are directed to this type of care. And so before, there was kind of a vacuum in this space, from what I understand. And now, as I'm entering into it, all the forums that I'm a part of now are, talking about now there's this cool EMR, now there's this one, who's on it, so there's just a lot of conversation about that.
Okay.
And I think there's a lot of drive for the technology community to help support this model, because I think a lot of people are just done with how healthcare currently is and want to try something different.
Sure. What is what's one of the biggest challenges you've met so far in looking into starting your own practice?
I think
besides all of it.
All of it's hard. I think the hardest part is that I'm currently under a non-compete. So many physicians are. Mine is a 25-mile radius from the places that I have practiced, which include the hospital and the clinic. And so all that to say, and it's very complex. You talk with lawyers about this, and they're like, well, you have to make sure you account for how the world curves to make sure that street is outside. It's just asinine, like how
very technical
far people will take it. But so to me, and I live in a very small community in the middle of nowhere, Wisconsin, and there's the hardest part has been knowing that in this gap that I'm taking, because I had to start that clock, there's a gap in care. And I'm not saying I'm the only person who can deliver it. I'm just saying I'm the only person here who's capable of doing it, because we're not bringing in people to do that work. And so, I run into people. I can't go anywhere without running into many of the patients or the families that I took care of. And they're like, what are we going to do? I'm like, I don't know. I'm like going as fast as I can, working this out. And so one piece we're considering, my very small little group of people that have been in this kind of world with me, but, do I go outside the non-compete zone and set up kind of a temporary clinic, maybe rent a space or something.
Okay.
And that's something that I likely will pursue sooner rather than later. And that would be a way. Obviously, families would then have to drive, but many are driving anyway.
I imagine it'd probably give you the opportunity to kind of start easing into it a little bit more and sooner. And
trying out some, kind of seeing what the appetite is, and kind of. So there's a lot of benefits to doing it that way, and so some other things. But vaccines are another huge headache. They're very expensive to purchase. Many people's insurance cover them, and so. Anyway, I've worked with many local pharmacists about how to do that, because I feel like despite the climate we're in, as a pediatrician, that is still the cornerstone of a lot of what we do. And we're going to start seeing some really yucky stuff due to declining rates. And so it's just important for me to at least be able to offer that. Many practices don't. They're just like, we're just not dealing with that. Go to the health department, do whatever you want. But to me, that just leaves an even bigger gap in at least that piece of pediatric care. And so, like a box of measles, mumps, rubella shot for 10 vials was $1,000 when I looked on a wholesale site. And so they're expensive for pharmacies too. And so just the logistics of like, could a pharmacy dispense that? So now we're working with Big Pharma again, because like only the big box stores would want to do this because of the cost. But would they dispense it to the patient who would quick bring it to my clinic, and we would quick do it? It's funny, the medical field, as many others, when they get to such a big status, is anything else it's like logistically hard. I would just walk into work and I would have everything I needed. I would have labs, I had vaccine, I have whatever. And I think that's a reason a lot of physicians aren't leaving or, don't want to do this, because it's just easier,
I mean, I'm sure to me and to many, it's a daunting task. And and you have to have all the right team behind you, and I'm sure finances to make it all happen and to make it go.
Right. But there's a lot of really great benefits and ways to start. A lot of the practices that have been in, the direct care practices that have been up for 5 years or more, like start with very little. You don't really need a lot. You need like a stethoscope and, an ear looker thing and, just some of those pieces that you can offer really good pediatric care with not a ton of overhead, at least to start, and then grow from there. It's been funny. I've had when other physicians and other clinicians have found out about me leaving and then what I'm hoping to do, I've had many say, build something cool and we're coming with you. And so which to me says so much. And I just feel like there's such an appetite for maybe not to like build it and figure all this out, but if I can lay the groundwork, like maybe we can change how care is done in our community.
And that's awesome I'm sure for you to hear that from people, to say that to you, because I'm sure in the whole vast of positives. There's like anything, there's
Yeah.
negatives and, people thinking it's not going to work and
Yeah.
things like that.
Yeah, I think over my time of being here and have grown up here, I have a really good support system. I don't think it would work as well if I just like planted myself in Ohio somewhere and just
Right.
said I'm open. I think it makes a difference that I'm known in the area as a good clinician and someone who will fight for your kid and have taken care of thousands of people. And so I hope that helps too. But there's a lot of logistics and. And the system's just not meant for it to be done in this way. And so I think a lot of us are trying to figure out a way to make it more tenable for others who want to try something different.
And I think from some of your answers, I probably have, can probably, assume what it is. But one thing I'd kind of skipped over asking was making that decision and actually, leaving where you had been. What was the hardest part of that? Just the patience you had and
it took me as long as it did to make that leap. My husband had been listening, and my friends had been listening to me like I should just go for so long. And it took a really bad call day where I was just absolutely killed, didn't get home for 16 hours. Like it was just really and it's fine. Like I can do that. Like in my training I can go days of doing that, but it was just like there's no end in sight. I'm going to be the only one doing this, and I can't do this by myself. And so rounds and rounds of negotiation where it was just very clear that there was no appetite to build something different. And so I think jumping off the ledge was one thing, but then I think it took me so long because there's so many patients that I care so deeply about, and many with complex health issues that I'm co-managing with really smart people in Madison or Milwaukee. And I was their medical home, and it just, and I know that what families are feeling. And I knew that I had to start this clock so I could maybe do it again in a short amount of time. Part of what I was asking for is like, fine, just let my non-compete go so that I can, if this continues to be yucky, then I'll be able to do something else for this community. And obviously they don't want to see somebody else take their kind of go off. And so understandable from a business perspective, but for small communities, it's just really, it really hurts the community. So.
Yeah. It hurts the families more than it does anything, I'm sure.
Yeah. And I mean, we're at a place where my husband's practice, we can be a one income family. Like it affects me. And interestingly, part of my solution next weekend, I'm doing some substitute doctor work. And so that's a huge thing. Like locums is what the name is when you go and work at a facility. There's brokers that are part of this. So obviously more middlemen, but they're, they help staff hospitals that don't have care. And so the facility I was working at is doing that too. They're pulling in doctors for like quadruple what it is for a regular doctor to just work there. And I'm going to Maine, for example, and going to be there for a week and take care of a lot of people. And so I'm excited about that. It's also hard because, I'm doing my job, but I have to go elsewhere to do it. And leave my family and stuff, which is fine. But it's an odd system. But
yeah, I imagine that'd be a cool experience too to kind of add that to the resume and go off to places like Maine and help out.
It'd be fun to see different systems too, and just kind of see what's working, what's not. And from what I gather from all my colleagues that I know, it's kind of the same everywhere. But also to be able to drop into a place and not have to deal with any of the business stuff, and then just like drop out. Will be interesting. So I think it'll be a fun way to spend some. So I have jobs lined up through the end of 25 and just here and there, which will be fun and a way to kind of stay in the game. And my kid asked me the other day at dinner, he was like kind of thinking, he's like, do you worry you're forgetting everything? I'm like, kind of now, especially that you said that. So it'll be good to stay sharp with them.
Yeah. And so I kind of asked, what is the hardest thing that you see and have encountered so far with, looking at starting your own practice? But obviously there's the patient end of it, but what are you looking forward to the most?
With having my own practice?
Yes.
I think just being able to do things the way that I want to do it and have patients drive what that is, as opposed to having people who live super far away kind of dictating everything. And then me and the patient are like, this isn't working for anybody. And so I think having more control over every piece of it. And obviously that means my time will be pulled in different directions. Like I've never been a business person, and in medical school, they teach you literally zero about business. And I think they do that on purpose to make us not be able to participate in this way. And so
Sure.
I'm learning this all as I go, and whatever. We're all really smart people. Like if you can make it into medical school, you can figure out a spreadsheet is how, but they make you feel like you can't. And so I'm really excited to just be able to set up something that kind of runs itself, or I have a really great, like solid team that has nothing to do with patient care that can help me when I need it. And then just start with a small amount of kids and see what happens. So.
Just starting out and kind of out of curiosity, and before we were talking about that, 1 to 10 ratio, what does that look like when a person has their own practice? What is, do you just need one other person kind of helping you facilitate, or, what does that look like? Or is it going to be just you at the beginning, do you think?
I think so. Many direct patient cares practices as they stand have just the doc, or maybe one RN. Like you work hard to be able to like hire an RN who like really knows your patients, and you would talk to her, but she really knows you, and she'll give you direct access to me, and so, but that's my concern is, especially if bigger health systems don't fill the void, like, in that time, I don't want to grow to a point where I essentially replicate what I left, I think that's a huge piece. A lot of people will have some front desk person that'll kind of help with, different pieces. But I think at least first it'll be just me, and maybe I'll rope my mom into helping hang out.
Sure.
So, I think that'll be the best way to start. Okay.
Gotcha. No, that, I was very, very curious. Yeah. What it would take to facilitate all that. And I imagine I'm sure with what you're wanting and wanting to achieve, being able to, it just being you and you alone being able to handle your patients will be a really gratifying feeling.
I think so too. And I think, I've as I said, I've talked with, members of the health department that I became very close with over the COVID pandemic, and, they're super supportive and had great ideas, and a handful of business people, including my husband, that are, helping not in an administrative way, but just like this is how to think about these financial pieces that I've never had to think about before. So I'm learning a lot, and I think finding people to be supportive and help to grow, but not to be an integral part where everything would, rely on what they think.
Sure. Now, if there's something I haven't asked yet about your journey into starting your own practice that you would want people to know, whether it's about you, your own the practice itself in general, what would that maybe be?
I think we've covered a lot of it, but I just think I want people to know that I didn't leave them. Like people have literally said to me, like, why are you leaving me? I'm like, I'm not leaving you. I'm also not leaving our area. It'd be so much easier and doctors do this all the time. Like they get fed up and they just move. And then, that resource is gone from our community, and I'm distinctly not doing that. And,
right.
Trying my best as quickly as I can to build something that people can access, whether that's outside my bubble, my non-compete bubble to start, and then bringing it back. But I have no intention of going anywhere, and I'll be a physician till the day I die. So we'll figure out a way to do it.
I'm sure that's great for a lot of people to hear. And I know the one thing that I've read on your Facebook page, and I think you may have said it, but kind of I'm going to call it your slogan, I want to make medicine feel better. I think that really resonates. I think did you come up with that on your own, I'm guessing?
I did.
Yeah.
And I just do. Like it felt so yucky to me, and I know it did to my patients. And hopefully they didn't feel it when they saw me, but I was becoming a different person and a different doctor. And that's even just stepping out of what I was in has been so healing. And I think, I can't help other people from a place like that. And that's where many physicians are. And so it needs to feel better for everybody.
Yeah.
Because people aren't getting any healthier. So we need to figure something out. So.
Right. No, and I'm sure, is tough, but your intentions are, as great as they could be, and wanting to start your own practice. You're not walking away from, the practice itself. You're wanting to have your own and stay involved and try and be, more involved. But I think the one question I'll ask too is, you had mentioned you wouldn't be able to see as many patients as what prior. What does that difference look like?
I don't know. A lot of direct patient care providers, tout that they have an hour per patient, and I'm
a firm believer in quality over quantity. Yes. So I
right. And also, if you know me, like I kind of always am going at 120 miles an hour. And so for me, spending an hour with a patient when needed, absolutely would be great to have that time. Like I know this patient has a lot of mental health issues. We're just going to have from 9 to 10. That's all I'm going to do. But also I do know I can, and I've done it, I can handle a lot, but it needs to be balanced with, I don't want patients to feel like now we're just in some walk-in situation again. And so,
right.
But obviously if someone's taking, if I'm taking 30 minutes to an hour per patient, working 4 to 5 days a week, that's way limited compared to the 30 I was seeing per day, so it's just going to be less. But there's, do I hire more docs who are just like me to do this work with me? Right. I as I alluded to, I taught a lot. I was like a main clinical pediatric site for the medical school in Wausau.
Okay.
I was an elective. People would come from other states to do their pediatric training parts of it with me. And so I have people all over who are
So you definitely enjoy training.
I love that. And I love teaching. And it's a huge part of what I love to do. But I have medical students now, residents that are like, we'll come, when we're done with training, we'll come do this with you. And so obviously when the rubber meets the road, and who knows, they might fall in love with something else and not. But
right.
I think I have a lot of connections where hopefully this could grow enough where we could take care of enough of the community that it would be meaningful.
Yeah. Is there anything, other hot button topics you want to make sure we talk about?
I don't think so. I think we covered a lot. So.
No, yeah, we did. We covered a lot, and and I really wanted to learn more about what you were doing and up to, because like I said, I was just super interested when you started putting things out there. And I think you have a lot of great videos and information out there. And actually it was one of our kids was having a fever, and you had just put out a video about fevers, and it was like, okay, the temp doesn't matter, and it, whether it's this or this temp, it doesn't really, there's not much of a difference into what's going on. It was like, okay, that's great to know. And we've, like many other parents have dealt with so many fevers, and so it's been great. And I encourage anyone watching or listening to definitely go on Facebook. Dr. Amy Falk, MD is your Facebook page. Is that the best spot, and is there anywhere else that you're putting out information that people can stay up to date on what you're doing, or just follow along with tips and parental medical tips and tricks?
Yeah. So I'm also on Instagram. Those are linked. And then I'm really not tech savvy. I have no idea what I'm doing. And so I have some 16-year-old helping me do all the cool CapCut stuff. And so it's really just sort of a grassroots thing. But there's been some interest in do I get into, YouTube stuff and doing some more of the parental teaching. And so perhaps in the future, looking at that. I'm in the process of a website design. And so that'll be all up on Facebook and linked through there. So, yeah. More to come.
Awesome.
Once I figure it out. So.
Awesome. Well, I will definitely, your Facebook page, Instagram, I'll put those links in the notes of the show, so people want to go, and if they're not found you already, which you should be, make it super easy for them to find you and kind of what you're up to and what you're doing. But no, thank you so much for coming and talking about all this. I think it's a really, health is important to everyone, and how your health is dealt with and handled is important. And, you should have an understanding in how it's handled and what's going on with it, whether it's you or your child. So, it's been great to get this information. And as things progress with what you're doing, I'd love to have you back on and maybe chat about some other things again. And
I'd love that. Thank you for having me. This was super fun and my first podcast. So
awesome.
Really awesome. Thanks for having me.
Sounds great. Thank you, Doctor.
Thank you.
Thank you for listening in to Speed and Grease. If you're a returning listener, I appreciate you tuning into another episode. And if it was your first time tuning into the show, I hope you enjoyed it and want to keep coming back for more. And if you haven't already, make sure you head on over to Facebook, Instagram, like and follow us on one of those platforms wherever you prefer, even on X as well. And if you watch a lot of stuff on YouTube, make sure you head on over to YouTube, subscribe to our channel there to stay up to date on everything. And also, if you want, give us a rating and review over on Spotify or Apple Podcasts as well. Thank you again for tuning in. I really appreciate it, and we'll catch you in the next one.